We've been involved in a variety of committees for NBA, NFL, and college sports as well, looking into why these sport foot ankle injuries occur and how to prevent them or how to best treat them. Hello, I'm Bob Anderson. I'm an orthopedic foot and ankle surgeon here at OrthoCarolina, and I specialize in sport foot and ankle injuries, really any kind of sports injury to the foot and ankle. The Achilles tendon in older athletes can start to wear down and you get degenerative changes and things we call tendinosis. But in the younger athlete, what we're most concerned about is Achilles tendon ruptures. And I've been dealing with professional athletes for 30 years. And what we've seen over the years is a gradual increase in the number of Achilles tendon injuries that are occurring. We used to think Achilles tendon injuries occurred in age groups 28 to 48. What we're seeing now with the professional athletes is we're seeing them occur at much earlier ages. We've even had professional or high-level gymnastic participants rupture their Achilles at age 15. And you go, well, why is that happening? Why are we seeing more and more Achilles tendon injuries? And we believe it's the fact that these young athletes are just doing so much throughout the year. They're not taking any time off. They just constantly go at it. And also we're concerned about the fact that most people concentrate on one sport. Years ago, high schoolers used to go from one sport to another sport to another sport. Now sports become very specific, and we think that that one athletic maneuver they do can cause more and more issues with the Achilles tendon, eventually lead it to weaken and rupture. There's certainly a genetic reason people rupture as well. There are certain people who are probably prone to getting it, but we do think that the amount of work that they're doing on the Achilles can weaken and lead to the ruptures we're seeing. So your Achilles tendon is one of the strongest tendons in the body, and the Achilles tendon, people like to say it's like a leader on a fishing line. It basically connects your calf muscle, and there's three calf muscles. There's two gastroc muscles and then one soleus muscle that come down into almost like a triangle that then attach to the Achilles tendon, and the Achilles tendon then goes down to your heel bone, your calcaneus bone. And so the Achilles tendon has some stretchability, but basically its function is to provide the connection from the muscles to the heel bone to allow your foot to plantar flex, which means push off. And so you can imagine you get these big athletes, a lot of power that are pushing off, and as they're pushing off, that tendon can just suddenly pop. And it pops typically right through the center of the tendon itself, not up by the muscle, not down by the heel bone, but right in the center. We call that a mid-substance rupture. And that's the typical site of the rupture that we see with Achilles tendon injuries. Over the years, the idea has always been to just put the two ends together. You used to make a long incision, find the two ends and just pull them together, use a lot of suture, almost like a rope, and just hold it there and keep the foot in plantar flexion like a ballet dancer for several weeks until it healed up, and then gradually let them get back into activity. It used to be said that if you had an Achilles tendon rupture and you're a professional athlete, your career was done. We've improved techniques over the last 10 years to the point where now we can do this through what we call a mini open approach. Just a small incision, grab the two ends with a specific device that goes up underneath the skin and helps pull the ends together, and we can do the procedure and repair the tendon with the appropriate tension through a really, really small incision. And what we found now is guys are getting back quicker and better, more reliably. And it's very unusual not to have a professional athlete come back to sport. Instead of having guys, off their foot for weeks and weeks and months, we can get them moving now in about 2 weeks after the surgery.